constant lower back pain is keeping you from enjoying life, there may be a non-surgical alternative that can alleviate that pain and get you back to doing what you love. Here to explain a different approach to lower back pain is physical therapist Abigail Velotis from STI Rehab. Good morning, Abby.
Good morning. Nice to meet you.
It is nice to meet you, too. Please tell us about STI.
Sure. Well, STI is one of the largest independent rehabilitation companies in the state of Arizona. Actually, we've been in the Valley for over 30 years, treating patients of all ages. We have 10 clinics presently, including one in Yuma.
Oh, wow.
And hopefully we're on our way to grow even more to service as many people that we can here.
And you're servicing people who, do you get a lot of people, I imagine, coming in complaining about that lower back pain? And
always.
They've tried everything else. They're at their wits' end.
Yeah. Unfortunately, back pain is one of those things that the National Institutes of Health actually says 8 out of 10 people will experience back pain sometime in their life. It's just one of those things that it's the #1 reason people even miss days at work. So we see, it's one of the things that we see and evaluate every day, multiple times a day.
Well, and it's something that probably affects, when you have lower back pain, it's like you have to get up out of your chair.
Exactly.
It hurts. You have to walk down the hall.
It affects everything.
And so it's probably very frustrating. So tell us about what type of treatments you guys offer. And I know a lot of people would wonder, are they covered by insurance?
Well, they usually are. Most people do have insurance to cover that. What's nice is that STI always makes sure that we do phone your insurance company, and we always let you know ahead of time. But most of these treatments, because they have, the medical literature has actually proven that physical therapy is one of the things that really does help relieve that back pain.
Is that what we're seeing right here? When someone comes in, you show them, where they could be having the problem?
Exactly. It's one of the things, we always like to let the patient know where the issue is happening, what the problem could possibly be, kind of go over it a little bit of what's going on with that. So we unfortunately do see it quite a bit in our day. I would say probably half of the evaluations that I do in my day could be some form of back pain, whether it's because of the things they're doing every day, shopping, picking up their grandkids, those kinds of things, or just what they do for work.
Right, or someone could probably have had an accident or something like that.
Exactly.
So you said that most people do have insurance that cover these treatments.
Yes, very much so.
And what sort of treatments are they?
Well, one of the big things that we do, we're very team-oriented, and we do a lot of things that are going to actually help so that these things don't come back.
Oh, that's nice.
So a lot of that has to do particular, specific strengthening type exercises that are involved. I mean, most people have heard things like, you want to strengthen that core. So we do a lot of core exercises. And basically what that is we really work on getting your abdominals stronger. We work on getting your low back muscles stronger. We do what are called dynamic stabilization exercises, which actually help those other muscles kind of come in. I always tell people, think of your back almost as a mast on a ship. You got a big sailing ship, you got the big mast, but what do you have against those masts? You have those big, long ropes that help with that sail and that rigging.
And you got to strengthen that so that pain doesn't come back.
Yeah, so it doesn't come back. Because basically what would happen is, just like those ropes hold that mast in place, otherwise it'll snap in a good wind, those little muscles really is what supports that spine. And so that's kind of pretty much what we work on. We also do a lot of manual techniques. We can do spinal manipulation. We can do massage. We can do what's called an A-stem treatment that really works on those muscles. We can actually taper back so that you have a sense of where things are.
What is this functional movement screening that I heard about?
Okay, well, a functional movement screening is one of the things that we offer. It's actually started initially with athletes. How are we going to know? It was a way of, it's a tool. It's a nice screening tool to be able to see where your asymmetries are. Where are you strong? Where are you weak? Where are you tight? Those kinds of things, unfortunately, can lead to dysfunction, can lead to those injuries. So if we can do a nice functional screen, as well as our initial evaluation, we can see where you are. We're troubleshooting where your problems are. You don't want to do the same thing over and over and over and over and end up
back
getting
where
hurt.
You started.
Right. So let's be proactive instead of reactive. And that's what a functional movement screen will do.
Oh, that's interesting. So, Abby, if someone is watching and they don't know if they're a good candidate, you actually have a special offer for our viewers if they're experiencing this lower back pain.
Yes, the first 20 callers, they're more than welcome to phone. We will do a functional movement screen. We'll get to see where they are. They will leave with a good idea as to what they need to work on. Those little asymmetries that we found, and the whole idea is to make sure that you don't end up having to come and see me. And if you do, we are always here and always available But
so willing to help.
Always willing to help. But
Thank you.
let's try to stop it before it actually starts.
I like that, Abby. Thank you so much. And you definitely don't want that pain to come back.
Not at all.
If you want more information about STI Rehab, just log on to their website, STIRehab.com, or you can call the number that you see right there on your screen.